Okay, we'll go ahead and get started now. We'll let a few more people into the room.
Good morning.
Good morning. And for those who are just joining, who just got in from the waiting room, if you would please sign in using your the chat box, just with your name and organization, or your name and if you're a parent or a family member or just a community member, just that you're here representing yourself. Okay, I think that's everyone out of the waiting room now. I'll try to keep an eye on it as we move forward. But we'll go ahead and get started. We ask that everyone will mute yourselves if you're not speaking. We're going to let everyone have an opportunity to speak later and share updates from their organizations. But we'll go ahead and officially call this meeting to order. Our board chair is unable to be with us this morning, Leanne Ainsley, as she had another standing appointment this morning. So she's not going to be able to join us. So I will just facilitate the meeting this morning. But we do welcome everyone to our February Family Connection collaborative meeting. And for those who may be new to this particular collaborative meeting, this is an opportunity for us to come together and learn more about what's going on in Morgan County, and as well as to hear what's going on with your respective organizations. So we are glad that you're able to join us this morning. We see that we have a full crowd here, so we're excited to be able to move forward. You all should have received a copy of the agenda, and we will just try to kind of go exactly by the agenda this morning. And basically, this is our call to order and welcome this morning. And I will just briefly give you our coordinators report and kind of what's going on with the Family Connection Collaborative. I always like to share that the Family Connection Collaborative is not a separate organization or a nonprofit. Basically, the collaborative is to you, our partners, who come together each month and at different opportunities in the over the course of the year to make things happen for children and families here in the community. So it's not it's not a separate entity. It's you, the partners, that's come together. It's what's known as a quasi-governmental legislative body, where we just come together for more than just to meet and confer, but to share information about what's going on, to follow trends, to gather data, and then to put together those partnerships that will make a difference. So I want to give you our coordinators report. I want to just start with our fiscal year quarter 2 report, our financial report. And each quarter we have to submit a report to our state office on what's going on with our finances, as well as what's going on with our programs. And so just to start off, our coordinators report will begin with our just the budget report. And for those who have heard me speak before, we operate on a $48,000 budget. If you look at this, you'll see this is quarter 2, which for our fiscal year 21. We have the expense type where you see on that first column. You have the second column, which shows you our approved budget for the year. That third column is what we spent this quarter or our past quarter, which was October through December. Then that column that says column 3 is prior expenses that began back in July 1st, our year to date, and our remaining budget. And so I just always want us to, as a collaborative, to know where the money is going and how the money is being spent. And as we talk today about the different things that we're doing, just how far that $48,000 is going because of you being able to leverage your resources as well to help move all the agenda items forward. So I just wanted to share that with you. If you have any questions, you can email me or ask questions a little bit if you have any questions about kind of how the budget is allocated and how it's being spent. A couple of people into the room here. Okay, so the second thing I want to share with you all as we move forward is the FY22 annual operating plan. And I do want to thank everyone who came out and participated in our planning last month with our at our annual strategic planning meeting back in January. We had a good showing of people, and it was exciting to see so many people who had an interest in the various various strategies that we have here. For those who are familiar with us, we know that we have three strategies that we focus on. We focus on children safe and family strong, which looks at early literacy as well as looks at early literacy as well as child abuse and neglect, and making sure those numbers are reduced in our community. And so we also have our Educated and Working, which helps ensure that we have a community that is graduating people who are ready to work and have the skills they need to work, as well as finding those in the community who want to work and getting them those skills as well. And the final one is our youth development, where we look closely at youth development as far as teen pregnancy, drug use, things like that in the community. And so, with that being said, I thank everyone for coming out last month and participating in our annual operating plan. Right now, I'm in the midst of pulling together all your thoughts and ideas. I didn't see a lot of changes in the plan from our previous years, but I will try to go in and add all of that and have it to our state office by tomorrow, that 15-page report. And then once they review it, make their edits, I will get you all that one pager that we can look at really easily to see kind of what we're going to focus on going into FY22. Right now, I don't know what the budget will be. Hopefully, it will go back up to the 50,000 we were before. But in today's time, I don't know what the budget will be. But hopefully, we'll be able to, again, do all the things that we have listed and want to do and complete in our annual plan. Um, the next thing I wanted to share with you, if I can get my screen to change here, is right now our Parents as Teachers program. We are in our fifth year as a Parents as Teacher provisional affiliate. And with the Parents as Teachers program, this program is really geared towards finding those families with children 0 to 5 and really doing, it's an evidence-based home visiting program. And the whole purpose of the program is to provide supports to the family and the parents to let them know that they are their child's first teacher and to give them whatever resources they need so they can support their children, their child's development, throughout those early years, as well as to ensure that they're ready to start kindergarten. So every 5 years, and we are in our fifth year now, every 5 years, the affiliate, the national office wants us to go through this accreditation process. And in that accreditation process is the 81 standards that we have to meet. And so this particular accreditation process ends April 1st. And so we're right in the midst of that, getting all our documentation to ensure that we can become a blue ribbon model affiliate that says that we're implementing this program with fidelity. So we're in the midst of that, and just wanted you to be aware of that. We also are now applying for year 6 of this funding for this particular program. And so that particular application is due in April as well. So I'm working on that as well. The next thing I want to share with you is our Baby Bulldog Early Literacy Initiative. And this is something we've been talking about for a couple of years now, where we are really focusing on that 0 to 5 population, where we realize it's so important that if children don't start school ready, then they will struggle throughout the rest of that literacy, throughout the rest of their high school and even beyond. And so we've been talking about this for a couple of years now, and we're glad to be partnering with the school system on their complete district-wide literacy program and literacy initiative. And with us, we're again focused on that 0 to 3. We did a lot of assessments and a lot of surveys and a lot of planning team meetings. And basically what we came up with as we looked at kind of where we wanted to be as a team, what we needed to focus on, what the need said was, one, we needed to strengthen our literacy team, basically so that we can ensure we have a common messaging, meaning that there is a lot of people that are in a lot of organizations that are doing a lot of great things with early literacy, but we wanted to make sure that there's this common message, because we hear a lot of times parents say, well, I really don't know what my child is supposed to know when they in order to start school ready, and what is early literacy. So we want that common message to be throughout. We also found that even though there's a lot of things in place for children once they hit 3 years old, there's not really a lot of early literacy or programming for children 0 to 3. And how do we get that to our parents? How do we make it possible through a centralized website, perhaps through mobile units going out, through making hotspots and things available for parents to be able to have access to services for 0 to 3 population. And then also providing those opportunities for parents to acquire skills at home. And that's through, again, different avenues of providing checkout materials and things for them to have at home. So these are the 3 main things that stood out as we move forward. And so we're excited to kind of see where the L4GA grant goes this year. And I see a couple of people from the board office on here. Maybe they can give us an update a little bit later on where things stand with that. But we're excited to, again, be able to be a part of this. The last thing I want to share in my highlights is, as you know, we do our agency spotlights each month. And I want each of you to have opportunity to be able to come and share from your agency. This is about a 15-minute that you will get an opportunity to share what's going on with your respective agency. Or if you know a little hidden gem, a resource out there that we may not know about that needs to be highlighted so that our families, our partners will know how to access them and just kind of know what they're doing, then also share the link with them. I'm going to send the link out either later today or sometime this week. If you're interested in participating, then I ask that you will participate in our agency spotlight over the next year. And we're doing it all the way through May of 2022. So that being said, those are all the highlights that I have. I know I've shared a lot of information with you, but if you have any questions about anything that I shared, just want you to know that we are rocking and rolling here with Family Connection and continuing to try to pull together resources that will continue to impact and positively make a difference in our lives of our family and children here in Morgan County. So with that being said, as I mentioned, I don't have any new business to share with you this morning. Um, we want to just move on to our agency spotlight for this morning. And again, this is kind of the opportunity you will kind of see how she does with sharing, that you will have an opportunity to share as well. So our presenter today is Sarah, and Sarah, I know I'm going to pronounce your last name wrong. Pedezra,
You're
and
fine, Pedraza.
and so she is the marketing account manager in the Northeast region for Amerigroup Community Care. As the marketing manager, she seeks partnership with community agencies and providers who focus on health, well-being, and education of family throughout the communities in Georgia. Part of her role is to provide families with information on the benefits, services, and resources Amerigroup Community Care offers. While hosting events throughout the communities in Georgia, Sarah realized the need to educate and assist families with child car seat safety. So without hesitation, she became a certified car seat technician, always seeking the opportunity to keep our children safe. Prior to joining Amerigroup, Sarah worked with DFAS and the nonprofit sector, assisting families with applying and receiving Medicare, TANF, SNAP, and SSA benefits, and is retired from the Department of Public Welfare, Community Wealth of Pennsylvania. Um, Her education is in mortuary science, and currently she's pursuing a degree in communications. But wanted to just share the information with you that Sarah, she does an outstanding job in supporting our community. We want to let you know about her and all the wonderful things that she has going on as well. So Sarah, if you would, take it away.
Thank you. Good morning, everyone, and thank you for joining us. I will be sharing my screen. 1 second. And okay. And can everyone see my screen? Thumbs up.
Yes.
Yes.
Okay. All right. So as Veldy said, my name is Sarah. I'm with Amerigroup Community Care. I have several slides. I'll go through them. I won't go in depth into each one, but I'll tell you guys a little bit about what we do. We are one of the 3 CMOs to provide health coverage to families and children determined eligible for Medicaid, PCHIR for kids, and planning for healthy babies in Georgia. We are also the sole provider for the foster care children in the state of Georgia as well. What families get when they choose Amerigroup? They get a primary care physician, low and some at no cost prescriptions. We offer unlimited over-the-counter medications, and we have many incentives. So when we do events, we go out to the community. Now, of course, because of COVID, we're doing this virtually and on a drive-through basis. but we're still providing our members and non-members with our information and getting them the resources that they need. We know that with COVID, it's imperative that families, receive the assistance they need. So some of the things that we offer at this time are pertinent to families with the unlimited over-the-counter medications. Children can receive, all the cough medicine, vitamins, keeping them, their immune system up. There's many. We do the telehealth as well, vision and dental care. Many incentives. And one important fact that I want to touch is coming in March. As many of you know, WellCare is being acquired by Peach State, which is Centene. So all of the members that are with WellCare at this time will be receiving notification from Georgia Families, letting them know that they can select another CMO between March 1st and March 31st. Now, they don't have to select another CMO. They can stay with WellCare, and at the end of the enrollment, they will be transitioned into Peach State, as WellCare is pretty much being consumed by Peach State. So what we are doing is we're letting families know that there are other options. We're letting them know of the new incentives that we're adding. We now provide members, moms, new moms, and moms 21 and older with a free Sam's Club membership. And we do this on a yearly basis. We are continuing providing the free Boys and Girls Club membership, Girl Scouts, Boy Scouts. Some of our members are eligible for a free Chromebook, which is something that would definitely benefit our high school students. Eye exams, glasses. We also offer an incentive for non-standard glasses if they don't want the options that the agency offers. Comcast Internet for up to 3 months for eligible members ages 14 through 18. Please know if you have a family that has a child that's 13 and Comcast is available in their area, tell them don't hesitate, contact Amerigroup. Because of COVID, we are flexing some of our benefits and assisting other families as well. We just did a partnership with United Way, where we are assisting families with going to get COVID vaccines. So we provide the transportation through Lyft. And this is open to anyone. They don't have to be enrolled with Amerigroup. They don't have to be enrolled with Anthem. This is just anyone. And they can just contact United Way via 211 to get more information on that. So to continue on here, we're providing our members with the information regarding WellCare to make sure that they stay or go with a plan that their healthcare provider accepts. So that's a main point that I want to make sure our families are aware of. And these are some of the value-added benefits that I mentioned. All of our brochures include this information, and if any of you would like some of those brochures, we can mail them to you. We can provide you information electronically, sending via email. We offer it in our virtual events. So a lot of things that some of our members are not taking advantage of are things like breast pumps when moms have babies. They're not taking advantage of that, or they're not, when they take the children to the doctor, they're not requesting the gift card that we offer, because our moms and for babies, they can make up to $90 in gift cards with checkups. When baby turns 6 months old, we provide a voucher for free baby food. So these are things that we want to make sure our members are aware. To look at it individually, it may be just one thing. However, to a family that perhaps lost a job or has limited resources and income or on a fixed income, all of these incentives will come together and help, and it'd be a tremendous help for our children and families. Some of our members are eligible for up to 7 meals, and we provide those on a home delivery basis. If you have any families right now that lost their jobs and they're with Amerigroup, we make exceptions. I know sometimes there's an age requirement or a particular health condition at this time that is being flexed due to COVID-19. Now, some of the other things that we offer that are new are the Sam's Club membership that I mentioned. We have an Amazon voucher up to $30 value for health and wellness for ages 15 through 18. So here we're targeting our teenage girls and boys, and giving them the opportunity to let them select what item they want. We give them the gift card and they can go on to Amazon and make the purchase. DoorDash, up to $75 value for summer month food program, and this is for ages 6 to 10. We offer utility assistance for eligible members, and this is on a $75 gift card, so they can apply to the utility assistance, whether it's electric or gas. As I mentioned, the Sam's Club, the Chromebooks for seniors. We're covering college application fees for eligible members. And a lot of times, the only requirement is that they have good grades and that they have their yearly wellness check completed. So we're trying to make sure that our children are going to the doctor and getting their checkups on a timely basis and keeping them healthy. And we also offer the working wardrobe kit. They'll receive on this a Uber gift card, and this is for eligible members 21 and up. Okay, and another important point that I want to touch is Medicaid renewal extension. So many of Medicaid and Peach Care for Kids and Planning for Healthy Babies recipients that are enrolled in these programs have renewals once a year. At this time, because of COVID and all the DFACS offices being closed to the public, they're extending benefits without requiring families to complete a renewal. So what we are doing is we are calling our members, one, to check on them, make sure they're okay, maybe there's something that we could assist them with, and also to notify them that if they have a renewal currently due, they don't have to, rush to the office or to drop off, in their Dropbox a renewal packet or do it online, because I know some families struggle with the online. So this extension will be, currently it's approved through March 31st. So any families with a renewal up until March, they don't have to complete the renewal. The state will automatically extend the benefits and send them a new notification when sent to renew. We do ask our members to please make sure that they keep their telephone number, their address, email address if they have one, updated on the Gateway website to make sure that if the state sends them a notification, they get it right away. So I'll leave that up for a second. And then we are also, our members and non-members can find information regarding COVID. We have lots and lots of updates regarding COVID, providing our families with more information, answer some of the questions that they may have, and letting them know that, we are here for them. Can you guys see this page I just pulled up, Ellie?
Yes.
Okay. So here, and I can share this link with you all. Here they can see where they can get the vaccines in Georgia. It talks about the renewals, the refills, a lot of information that, families can obtain. And as you saw, I just clicked on the link. There's no signing in. There's no registration. That information is free and open to everyone in the public. So these are just some of the healthy rewards, how the members get their incentives. They can just create an account online on myamerigroup.com, as you can see here, or they can give us a call at the Healthy Rewards. So when they take their children to the yearly checkup, all they need to do is give it, I would say, like a week or two for the doctor to submit the claim. Once that comes up into our system, they can request their incentive. And here's our Amerigroup website. And this is something I have been dying to share with you all, because this is something that as a community partner, you can benefit from it as well. So on our website, on myamerigroup.com/Georgia, you will find, of course, all of our information, whether it's for foster care, planning for healthy babies, peach care for kids, or Medicaid. But you can also find our community resource link. And what is our community resource link? We have a partnership with Aunt Bertha, and this is like it's a online platform where families, anyone, whether you are in Texas, Florida, or Georgia, anywhere in the States, you log on to myamerigroup.com/Georgia. If you see the tab here that says your community, you select that, you enter the zip code of the location of where you need services. Once you click search, it will bring you up to, are you seeking for food assistance, employment assistance, transportation, anything that you may need will come up on here. So if you're trying to help someone in your particular county for seeking an employment, you can find it here. And this is something free to our community partners. We pay the membership with Aunt Bertha. You as our community partner can claim your account, update your information from your hours, services. You can do referrals electronically from one agency to the other. Once you find the location that you're looking for, you will see that you can print out for the customer all the details on the agency. So here, for example, if I enter my zip code, it'll show me all the services that are within a particular area. So there's a total of over 1,700 programs in my area. And here I can select, am I looking for food assistance, whether it's a food delivery, a food pantry, emergency food assistance, housing assistance, and so forth. So many options that you can select. Once you find your agency, again, you can claim it, you can refer someone. This is a great tool that I always mention to all of our community partners and families. It's amazing. And one second. Okay. So also on our community, on our Amerigroup website, on the right-hand column where you see community events, we are divided into, divided into regions. But please know that if you're in the Atlanta region and you want to attend an event there because you were visiting a friend, you can definitely do so. You're not limited to just the region that you are in. You can click on that and you will see all of our events that are currently happening. And at this time, we are hosting events virtually, drive-through, whether it's a car seat event or a baby shower. We'll do a virtual baby shower, and then maybe the next day we deliver the items to the family. So we still want to continue reaching out to our families and providing them with the same events, same resources that we provided them before. And I know in Morgan County, we used to do the baby shower, so I'm gonna see if we can schedule like a virtual one and then offer families the same services that we did before. This would be great. And as I mentioned, the renewals are being extended, but if a family is receiving SNAP benefits, that's different. So they still want to contact Gateway. They contact their caseworker, whether it's via email or electronically. Here are the phone numbers to Planning for Healthy Babies, to Medicaid, Peach Care for Kids, just some information for families, just to make sure that they are on top of, their benefits. And okay, so these are just some of the events that, of course, as you guys may know, that we hosted pre-COVID. We're still doing the events a little bit different. The drive-through, we try to encourage families to stay in their vehicles. For our drive-through events, families do not have to register. They don't have to provide us with their name or anything like that. It's just strictly drive-through. We provide face masks, we provide gloves to our volunteers or community partners that join. We do practice social distancing throughout the event, but we still want to continue being there for our families. And I want to thank you all. And any questions at all for Amerigroup?
I saw someone had typed in a question in the chat about, do you have to have an account to use the community resource tool?
I'm sorry, say that again?
Do you have to have an account to utilize the community resource
No,
tool?
no, you do not. And
Any other questions for Sarah?
LD, I just wanted
Okay.
to thank Amerigroup for writing a letter of support for our L4GA grant. We're excited about partnering and kind of unifying the message about literacy. And so thank you, Sarah, for agreeing to partner with us.
oh, absolutely, you're welcome. And I'm looking forward to it, and always I'm here for you guys. You're
Thank you.
welcome.
Okay, so we're now going to move into our again, okay, there we go. We're going to move into our strategy team reports, and we're just going to ask everyone as they come up if you would just kind of highlight what's going on. Our first strategy team is our Children Safe and Families Strong strategy team, and the first one is our Parents as Teachers program. I'm not sure if Maria is on the line this morning, but I will give you the update on our Parents as Teachers program. Again, I kind of highlighted a little bit earlier, but we currently are serving 20 families, which is pretty much a full caseload or for Maria, who is our parent educator. She can have between 20 and 25 people, but really 2022 is kind of where we kind of want to keep her. We are working on the grant for next year, and so our grant is due in April, and we will be looking to expand our the diversity of the parents that we serve. So if you have families right now, again, we are full, but if you have families that would benefit from participated in an evidence-based home visiting program that is geared all towards, again, early literacy, identifying, we do developmental screens and milestones with families, identified, and there are several families that we have identified that have been referred to Babies Can't Wait. And again, identifying these children early before they get to kindergarten is going to make a real big difference in making sure these kids are ready and students are ready for kindergarten once they get there. So if you have families that would be interested in this program, please let us know, and we will definitely do a referral and over to that program. Amanda, if you want to give us an update on the Parents as on the First Steps program.
Yes, good morning, everyone. I hope you all are staying warm and dry on this cold and wet morning. I don't have a lot to report today. However, I'm excited to announce a few upcoming trainings. The first one is our First Steps Advanced training. It's in August, but I'm looking forward to that. This is where our First Steps sites, all of our First Steps sites in Georgia come together and share what's going on at our sites. We share resources, and we also hear about updates from the state level. Unfortunately, it's going to be a Zoom training. So all the interaction that we have in person is not there, but all the resources is still there. The other upcoming training is the safe sleep training. It's important for families to know all the safe sleep guidelines, especially the new parents, and how important it is for parents to not bed share. I know it's a common thing, but anything that we can reduce SIDS and all the child abuse and all that safe sleep guidelines that we can share with our parents is very important. Lastly, if you know of a family that could use our First Step services, if you could please share my info with them, or if you could give me their info and I will contact them. I have put my contact information in the chat box. I will re-enter it in case it has lost in there. But feel free to reach out to me with any questions or any resources you would like to share as well. And thanks again. I hope you all have a blessed day.
Thanks, Amanda. And now, Brittany with Project Free, if you would go ahead and share what's going on with Project Free.
Good morning. Thank you, Veldy. So we are nearing the end of our implementation phase of our new grant cycle, Family Relationships and Marriage Education Works Project. Again, we have expanded across the entire state of Georgia and working with 8 community-based agencies. And they are actually Bright Path, PCA in Athens, Georgia, as well as Community Action for Improvement in Troup County, Economic Opportunity Authority in Savannah, Georgia Center for Opportunity in Gwinnett, Lanier County Family Connection, as well as Overcomers House Incorporated, also of Gwinnett, and Refresher Community Incorporated out of Henry County, as well as 8 extension offices. We will be, again, offering our Elevate couple workshops. That's our focus for our next 5 years. And for this cycle, all those who are at least 18 years of age, identify themselves in a committed couple relationship, are eligible to take our classes. They are free. We are providing our wonderful incentives in the form of Amazon e-gift cards. Upon completion of the program, the couples are eligible to receive up to $160 in Amazon e-gift cards. Again, there's no other needs, is that any couple who identifies with any stressors in relationships, which is, we can say, all relationships, they do not have to have children. We understand as we shifted into this new cycle, dealing with what we have been doing for almost a year now with COVID-19, we do understand that relationships have gone into other stressors. So throughout this, as they elevate their relationships, to also learn skills about communication, that is very beneficial in other aspects and other relationships outside of their personal or romantic relationship as well. So we expect to begin classes in late April and May. The format for those in some of our agencies will be in person, but we are mostly in virtual classes. So we'll be offering those it's a 12-hour program over 8 sessions virtually. And that you also can register through our we are in the phase of also finalizing the updates of our new website, but they can also register for our UGA virtual classes. So I will keep you updated monthly. Again, my information is in the chat, my email, phone number. So if you want any more details as we progress and near the end for registering couples, just please give me a shout out. Thank you.
Okay, thank you so much, Brittany, for that update. Before we jump into our youth development, because this kind of ties in between youth development and our Children Safe and Family Strong, that early literacy piece, I do want to ask if Susan Tolbert with the Board of Education wanted to kind of share any information on the district-wide literacy or anything that she would like to share. I think she had to jump off a little early if she hasn't already jumped off. So Susan, if there's anything you want to share as we jump into our youth development strategy.
Thank you, Veldy. And first of all, I want to say thank you for coordinating our Birth to 5 plan. I know it's a major undertaking. So for those of you who aren't familiar, the L4GA grant is Literacy for Learning, Living, and Leading in Georgia. And we really wanted to capture the voice of lots of different stakeholders for our community by doing a comprehensive needs assessment to see what we needed. And basically what we really ended up with, of course, the overarching goal is improving literacy in our community with 2 real objectives, and that was common messaging and a common focus on evidence-based practices and getting resources and teacher and parent education about fostering literacy development into the hands of all of our stakeholders and looking at those evidence-based practices. And so we've had a group of about 20 plus in our district literacy team meetings since September. And then each of that group each of those age bands has smaller subcommittees that focus on those specific age bands. And that's how we develop those goals. And we are actually, hopefully by this afternoon, we will have our, what we think is our final draft ready to be sent back to our chairs of our smaller subpopulations, and our system governance team parents will be reviewing that application as well. It's due March the 1st, but I'm hoping to actually submit that next week so that we can let go and let them have it to go ahead and start to be reviewing that. So we appreciate the community support here in Morgan County. Our people are our strongest resource, and we know that working on the development of children is most important to this community. So thank you, Veldy. Thank you all of you who have partnered with us, and we are eager to get that grant submitted and wait until May and see what good things hopefully will become of it. Does anyone have any questions?
Okay, thank you,
All right.
Susan, so much for sharing.
Thank you, Veldy, and have a good day.
All right, you as well. Okay, the Teen Maze, 2021 Teen Maze. Is there anyone, Leanne is not on the call to be able to share. Is there anyone that is serving on that committee that can kind of give us an update? I know it's going to look a lot different than it has in previous years because of what's going on in our community. But is there anyone on that planning team that can give us an update? If not, the only thing I know is that it's going to look a lot different this year on a much smaller scale. Is there anyone that can share?
Hey, Veldy, this is Megan. I can give you an update real quick. As much as I know, we're actually scheduled to meet next week, I believe. But as you said, Teen Maze is going to be very different this year, primarily because the health department or public health normally plays a large role in that with the pregnancy stations and STD stations. And because they are so tied up at this point with COVID, administering the vaccines as well as doing tests, they are not going to be available. So that kind of changes the whole scene of the Teen Maze, and the decision has been made to move forward with basically doing the crash scene and an ER scene. And so we are kind of having a modified group that is working together to get that done. We have not had our first meeting of just that modified group. That'll be next week. And then there's been some discussion about maybe incorporating some different grades, because the grade last year, did not get it at all because it was canceled. So we may be doing two different tiers to cover both. Maybe the freshmen and the sophomores this year because they didn't get it last year. So that's kind of where we're at this point. It is still on, but it's in a modified format, and we're working together with the school system to outline those details. We should be able to give more specifics after next week's meeting.
Okay, sounds good. And while you're updating, you want to go ahead and update us on what's going on with the hospital?
Sure. The hospital's doing well. We are still seeing COVID, but thankfully we have seen a decline in the last few weeks. Probably 3 to 4 weeks ago, we had a pretty high number. We actually had more COVID patients hospitalized than non-COVID in terms of the inpatient numbers. We have seen that change, and so that's a good thing, but we are still very busy. We're still doing our elective surgeries. The surgical suites are staying very busy. We've opened back up our swing bed program, so we're doing a lot more of the inpatient rehab type things. We are still operating under strict visitor restrictions. Really, the only visitors that are allowed at all are for those inpatients who are here for rehab for an extended period of time, and they're not on isolation precautions, meaning they have no COVID for sure, but nothing considered to be communicable. And it's one visitor per day. So it's essentially just immediate family, and it has to be cleared. So, but we are thankful that we're able to open up just a little bit, because that's an important part of the healing process for those patients, is that social interaction. And we realize the importance of that and try to do what we can in that regard. Another just big update you guys have probably seen, we are planning a COVID vaccination clinic. I can't give you any specific dates yet because that is completely dependent upon us receiving the vaccine. We have applied for it 2 to 3 weeks ago, but as of yesterday, we still had not been given any update on when we might receive it. We're not thinking it'll be this week because according to DPH, most of what is going out this week is all considered to be second dose. Anything we would be giving would be first dose. So we don't anticipate this week. As soon as we receive vaccine shipments, then we will schedule a date for that first community vaccine clinic. And we had a meeting last week with lots of key players, public safety, public health, things of that nature. That will be hosted at the Morgan Memorial Hospital site. The plan is for it to be a drive-through unless there's severe inclement weather, just because that's a much better format with isolation precautions and things of that nature. We just feel like that's a better option for the community. We cannot limit it to just Morgan County. Department of Public Health will not allow us to do that. But we are hopeful that, the majority of those we serve will be able to be our local community members. But the only requirement basically is that individuals be a member of 1A and that they have be a resident of Georgia. So they have to have a valid Georgia driver's license or ID card. Online registrations for that will start tomorrow, but you'll merely be registering saying, I'm interested in the vaccine. You will not be registering for an appointment, as we do not have a date for that drive yet. You will be contacted closer to time with a date for the appointment. Again, just in a nutshell, that's 65 and up, healthcare workers, police, fire, safety, first responders, all those folks who fall under the traditional 1A, because that's as far as Georgia has progressed at this point. That's pretty much the key updates on what we're working on right now. If anybody has any questions, you can feel free to send them in the chat box and I'll try to follow up with you and address as best I can.
Okay, thanks, Megan.
You're welcome.
I have a question.
Sure.
What about 62 years old?
No, the Department of Public Health, the state guidelines say 65 and up right now.
What if I lie?
That's on you. But we catch you because you have to have your ID.
Okay, thank you.
You're welcome.
And Megan, a question, how did they get
I
access
have
to that link, the registration link?
It's morganmedical.org/vaccine. And if you go to the hospital website, morganmedical.org, you'll see a thing at the top of the page as well. But it is not live right now. It will not go live until tomorrow.
Okay, thank you.
Quick question. Do you want me to see if we can put this, an announcement about this in the city newsletter when it goes out with utility bills?
That would be fine. Yeah, that would be fine.
I'm putting my email in there. You can just email me any
Okay.
details. It'll be a short blurb potentially. I'll see if we've got room in it. They're kind of almost finished drafting, but we'll see if we can get it in there for you, okay?
Okay, thank you.
Okay, any other questions for Megan? Okay, if you have any, just again, put them in the chat box. And she said she will try to respond to those as we go along. I'm going to keep moving here. The back to school rally. We are just in the early planning stages of the back to school rally, but again, know that this year it will also look different than it has in our previous years. Looking more towards a kind of drive-through event for this summer. But right now we are just in the early kind of looking at options right now, and we'll have more information for you as we go into March for kind of where we're gonna kind of look at that. As we transition to our youth development and educated and working community, I do want to ask if I see Dr. Cole is on the line, if he had anything he wanted to add as we get into our educated and working community, kind of what the school system is doing and highlights he wanted to share, and then we'll jump into other programs that is under our educated and working.
Just reiterate, thank you. Good morning, by the way. All the support y'all given us and Fidelity and all that. I appreciate all the work with the L4GA. Susan's worked a lot of hours along with others to kind of get that off the ground, and we really appreciate that. Things are improving a little by little, which is really nice to see. As Megan was talking about, when we came back second semester, we were dealing with another wave like we did probably at the beginning of the year. But our numbers are reflecting that, like everybody else is going down. So that certainly helps us, and just very proud of our staff. And, we're just taking it day by day. And, it's not easy for our staff and a lot of our, what they're dealing with, but, they've been really great. And this whole thing in the community has been awesome. So just very thankful for that. And so it's kind of neat hearing about the back to school drive and things like that, because it shows you we're starting, things will turn the page here before long. I mean, we passed well over the 100th day of school about 2 or 3 weeks ago. So, we're about to hit halfway point of the second semester in the next probably 3 or 4 weeks. So it's just amazing how fast it goes, and just glad that we made it this far. So thank you for everybody. And if you have any questions, I'm certainly willing to answer anything.
Thank you so much, Dr. Cole. And thank you for all the work that you and the school system is doing in keeping our children educated during this particular season that we're in. We really appreciate your hard work and the dedication and all the sacrifices that has to be made. So thank you.
Thank you.
Okay, is there anyone from either the WorkSource Georgia or from the technical schools that can give us updates on any of our manufacturing ready, our workplace development strategies that are being implemented right now? Is there anyone that can give us an update? And if not, I know that the last time I heard that there was still funding was still pretty tight. There was with these specific programs and being able to get funding for particular programs, but that applications I think was still being taken, but it was just a matter of kind of funding and where funding was. So that's the last update that I have. And again, this particular strategy is about connecting people in the community with resources and with programs that get them the skills, those soft skills, those hard skills that they need in order to become actively working in our community. I've come to learn a long time ago that not everyone wants to work, but for those who really want to work and really want to be able to maintain sustainable employment, that is a great opportunity that we have with a partnership with the, like again, WorkSource and some funding through them and with our technical colleges to be able to get individuals those skills that they need. So we will continue to funnel the information out, and as I get it, I will forward it on to you. And if you have anyone that is interested in any of these programs, please let us know. Okay, that's all that I have. And I know we have several people that is on the line, and this is what we call our time to share, our spot, where you get a chance to share what's going on with your respective agency. And because we have different people on the line, I'm gonna have to go to, I think, gallery view because I can't see. Well, no, I can do it this way. And so what I will do is I will just call you as I see you on my screen. And just to give again, this is like what we call in our church is a pop-up. So like popcorn does it pop up really quickly because we have so many people, we want to make sure everyone have an opportunity to share. So if you have a highlight or something that is kind of pressing that you want to share with our community partners, then please let us know. But this, again, this is not the agency spotlight. So we say 2 minutes or less. I would try to press for 1 minute or less, but at least 2 minutes or less that you just kind of share what's going on with your community. I see, Reggie, did you have your hand raised? Did you have a question?
No, ma'am. I just want, I could just, wanted to be seen first. So I could jump in.
Okay, go ahead. And then I'm going to go by the people, how I'm seeing them on my screen.
Okay, yeah, just really quick. Reginald Johnson, community marketing rep from CareSource. Just wanted to remind everybody that open enrollment for the ACA started back again yesterday. So if anybody who works for your organization or if anybody that you serve missed open enrollment from November and December, or if anybody had any changes, lost a job, moved, had a baby or anything, any of those qualifying events and thought that they could, or, anyway, if anybody needs to have insurance, open enrollment just started again. And also we have our Medicare program as well. What I'm going to do is put the CareSource information in the chat box. If anybody has any questions, I put my contact information in. Just feel free to reach out. Thank you.
Okay, thank you. Brittany Lowry, before you jump off, did you want to share anything with the group? Okay, she may have already jumped off, but Brittany is with Advantage, and they're still providing services to Morgan County. And Advantage is the behavioral health service agency here that serves this agency. And so they have walk-in intakes Monday through Friday from 8 a.m. And you can look in the chat box and see that information. Commissioner Harris, I have you next on my screen. If you would like to share anything that's going on with the county, if you unmute yourself and share.
Come on, Moog here.
Okay.
I'll start over again. Good morning to everyone.
Good morning.
Okay, the Board of Commissioners is holding a public hearing concerning subdivision regulation from 3 to 5 p.m. today. And then our Board of Commission meeting will follow at 5 p.m. So that's about all I have today. And if you have any questions there, you can call me.
Okay, thank you so much, Commissioner Harris. The next person I see on my screen is Terry Howard. If you would, do you have anything you would like to share? And then following Terry, Commissioner Joyce.
Thank you, darling. How you doing today? I was just called recently to the communication director for the Church of Jesus Christ of Latter-day Saints. And so I'm still learning my position. Basically, what they want me to do is to present who we are and to see how we can help. So I'm listening is what I'm basically doing, to know how we can jump in. If y'all need our assistance in any kind of way, we'll be glad to help out.
Okay, thank you so much, Terry. Just make sure your information is typed in the chat box, and that way we can have it for future references as well. Councilman Joyce, you have anything you want to share from the city?
Yeah, I do. Thank you, Veldy. I just wanted to talk about one thing. Friday was kind of a real milestone for the city of Madison. I think we did groundbreaking for the new Canyon Crossing workforce housing project at the kind of northwest city limits. As you go out 83 towards Bostwick, it's a couple of blocks past Pearl, hang a right. It's real exciting. This has been a long-term dream of the city to provide affordable housing, workforce housing. This is not going to be public housing. It is not Section 8. This is workforce housing supported financially by Georgia Department of Community Affairs. So it'll be, I believe at the moment, it's going to be requirements of $26,000 to $36,000 a year income to be eligible. The rents will be pegged to a sliding scale based on, I believe, the county per capita income. Very similar to what we have at Silver Lakes, but that Silver Lakes is for senior living, 55 and older. This will be for families, workforce families. So there's going to be a total of about 60 units. I think it's about 10 one bedrooms, 20 or 30 two bedrooms, and I think 23 bedrooms. There'll be public space along with that, outdoor space, playground, laundry facility will be on property there. They're looking at about a year construction time, so this will be available about a year from now, early spring of next year is the plan, 2022. So it may, perhaps as many as 200 residents will be able to find rent-supported housing out there. All rents, no purchasing. So we're very excited about that. The DDA did a lot of work on that. They're kind of an offshoot of the Madison city government. They do operate on their own. They receive funding from the city, and then they go out and get loans to purchase the land. Commissioner Harris and the rest of the Board of Commissioners for Morgan County did allow us to annex that chunk, because it's right, the majority of it actually was in the county. Anyway, we're really excited about that, and I know somewhere down the line, Bryce will probably add other things for the city, but I just want to talk about that. Thank you all.
Thank you. That's exciting. So glad you were able to share.
Veldy, this is Anthony. I don't mean to interrupt, but I have to jump off. I just wanted to share something really quick, if you don't mind.
Okay, go ahead, Anthony.
Hi, good morning, everyone. My name is Anthony Ivey. I'm the Community Relations Coordinator with WellCare Health Plan, and one of the 4 health plans for Georgia's Medicaid, Peach Care for Kids, and Planet for Healthy Babies members. I wanted to thank Sarah with Amerigroup for sharing that information about the open enrollment period, the special open enrollment period for those WellCare Health Plan members. I also wanted to make you all aware that actually I will be losing county as one of the areas I'll be working in. However, I do have a great coworker who will be actually replacing me. Her name is Diana Howell, and I just wanted to introduce her to you all, as she will now be attending these collaborative meetings.
Okay, thank you. Thank you for sharing. We hate to see you go, but we're really looking forward to working with Diana. Our next person I see on our list is Jim Doherty. I think you pronounced your last name, Jim. Everything.
You did. Good morning. My name is Jim Doherty. I'm part of the Action Education and Training team. The program I'm with, I'm a career coach, is Achieving Career Excellence, ACE, and we're focused on, at this moment, building a welding cohort. And the training will be, it's 4 weeks, it'll be in Athens. 4 weeks occupational skills training, essential skills training. And the other thing that we provide as a career coach is 12 months of monitoring, follow-up, coaching, anything anyone needs to be successful. So this certainly plays to your key strategy of ready to work. Our last cohort finished on the 5th of February, and all of them are working today, earning $18 an hour. So we're proud of that, and wanted to extend the invitation to Morgan County to anyone that be interested, focused on returning citizens, those progressing through recovery, veterans, SNAP recipients, and those are 55 and over. And appreciate your time this morning, and my information's in the chat box, and look forward to hearing from anybody. Thank you.
Thank you so much for sharing. The next person I see on my list is Quisha with Head Start, Early Head Start. Quisha, you want to give us an update?
Hi, good morning, everyone. My name is Quisha Glover. I work from YMCA Morgan County Early Learning. We have centers around the Northeast region, such as Greene County, Winder, and Alberton County, excuse me. So I just want to give you a bit of information. Right now, we're still recruiting for our program. At the site that I serve, we serve from ages 1 to 5. We're partnered with the Morgan County school system, so our 3-year-olds do not have to do the lottery program. They automatically go over. We do, for educational services, we do developmental screenings. We refer children to Babies Can't Wait or the school system. For health services, we provide vouchers to our parents so that their child can go to the doctor or dentist. It's just a great program. It's free. I don't want to feel like I'm throwing out so much information, but we do hold parent meetings. So if you guys anyone would like to speak at our parent meetings, because we do like to source our parents out to the community. If you guys would like to speak, please feel free to email me. I'll definitely put my information in the chat. So we're all about parent education as well. So thank you so much, and have a great day.
Thank you for sharing, Quisha. The next person I see on my screen here is Paula with Circle of Love. You have any updates, Paula?
Yes, ma'am. Good morning.
Good morning.
I'm Paula Allison. I am the legal advocate at Circle of Love. We are a domestic violence shelter. We cover 5 counties, Morgan, Greene, Hancock, Baldwin, and Putnam. So as you can imagine, the pandemic has wreaked havoc on the scale of violence that we're seeing. Nationwide, domestic violence has increased by 46%. Here in the state of Georgia, is more like 50%. I do protective orders for the 5 counties that we serve. I saw an increase of 58% from the prior year. So there's a lot that goes into that. There are victims that are locked down with their abusers because of the pandemic. The kids are home. Folks have lost their jobs. Just so many different things that have increased the stress in the home. And where there was already violence, it's just ramped up. And where there wasn't necessarily the violence that we saw, that there was stress and that type of thing. It's really increased. Shelters all over the state of Georgia, including ours, have been just slammed. We stay full. We're working through it. We're doing the best we can. I want to reiterate, we are not a homeless shelter. We are a domestic violence shelter. We house women and children who are fleeing from domestic violence. So we covet your prayers during this time, because we are slammed. We are overrun. The need is great. So just keep us in your thoughts and prayers, and we appreciate y'all. Thank you.
Thank you so much for sharing, Paula, and thanks for all the hard work that you do in keeping families safe here in our community. Diana, I know you didn't get a chance to say hello when Anthony introduced you. If you want to say hello now, as we look forward to working with you.
Yes, ma'am. Good morning, everyone. So glad to be here. I put in the chat, I'm looking forward to learning about all the partner agencies. So I am Diana Howell, a bilingual community relations coordinator with WellCare of Georgia. And as Sarah already mentioned in her presentation, WellCare will be merging with Peach State, and we have the open enrollment. So we really want those that work with low-income families or families that are receiving Medicaid, Peach Care for Kids, Planning for Healthy Babies, to please share this information, because one of the things we see is that people will get the letters, ignore them, and what we don't want is people to be upset once they find out that they can no longer go to their provider or not understanding what's going on. So please, if you have newsletters that go out to parents, if you have meetings that we could come out and talk to them about what's changing. As you all know, and Sarah went over her benefits, each CMO offers different value-added benefits. And so we had some WellCare, Peach State has their own. As we're merging together, we've reviewed the benefits, and they will be changing. We have some awesome benefits. I'm glad that we're keeping our scholarship, we're keeping YMCA memberships for eligible counties, and some more. So I would love the opportunity to share, collaborate, partner with you on any events that you may have, parent meetings, and also to share our events, because we continue to work virtually, doing virtual events as well as drive-through events. So I would love to learn about what's going on in Morgan County. Thank you.
Thank you so much for sharing, Diana. Brenda, I see it says Lisa Gotro, but I see it's you on the screen. So hey, Brenda, you have things you want to share with us?
Good morning. I apologize for that. I was borrowing Lisa's Zoom to schedule some meetings. But good morning, everyone. I wanted to talk just very briefly about 3 of our programs. I'll start off with our two educational programs that haven't been mentioned, which are our Opportunities to Excel program. And this program works with beginning with high school juniors and then continuing throughout their college careers to help them graduate from college, whether it's a 2 or 4 year institution. Right now, we're serving 24 participants. They're doing very well. We provide career coaching, case management, just all the support and some financial assistance to help these students, all of whom are first generation college students, be successful throughout their college careers. Throughout our 10-county area, we have 24 who are enrolled, and 4 actually are enrolled in Morgan County. And we have spots to serve 1 or 2 more participants from Morgan County. So in just a moment, I'll type in the chat box the program director, who is Andrew Alvey, and his contact information if anyone would like to make any referrals to this wonderful program. The second program is our high school youth program. We operate that within 12 counties. Our goal is to serve 120 participants each year. Our goal is to help high school students who really are at risk of dropping out of high school to not only graduate, but then to go on to post-secondary education, the military, or employment. In Morgan County, we have 6 individuals who are enrolled, 3 pending applications, and we have spots to serve at least 10 students in Morgan County. So we may be able to serve 1 or 2 additional students. I'll also type within the chat box who to get in touch with for this program. It offers not only the case management services and that career coaching, but also some opportunities for work experience. And this be the work experience opportunities for the upcoming summer would be an online platform. So it's a wonderful program for our high school youth. And last but not least, I'd like to talk about our community services program that provides everything from really basic skills, housing assistance. We also have a garden program, a spring garden program, and some summer youth scholarships. Right now, we're focusing on housing assistance for individuals who need assistance with rent or utilities due to a loss of income or an unexpected expense. And this could be either caused by COVID or other reasons. We do have some financial assistance available. And Shanice Cowens, I mentioned I would speak for her today, but she is our Morgan County coordinator, and she is on the call, and she'll be typing into the chat box her contact information. We would love to receive some referrals to help individuals with housing assistance, whether that's rental assistance, utility assistance, or both. And she also has a flyer that she would like to email out to the Family Connection members, just to tell them more about the program so that they will be able to share throughout the Morgan County community. So that's all I had to share. If anybody has any questions.
I do, Lisa. This is Angie Browning with Georgia Vocational Rehabilitation. And I work with the high school kids over at Morgan County. And what was the name of the program you just mentioned?
Okay, it's our high school youth program.
Okay. I might call you separately and ask a little bit more about that.
Okay, we'll be more than happy to share.
Okay. Because I think our goals are the same. And that would be, now I work with the kids that have IEPs.
Okay.
Still, we might be able to, talk about some common resources and also common services that maybe I could bring to some of these kids too. And the referrals that I get come directly from Morgan County High School.
Okay, wonderful. We would love to work with you.
Okay. And is your number somewhere listed?
I'll type that into the chat box.
Great.
And again, I apologize. I'm Brenda Dove. I was borrowing my boss's Zoom for this morning, so I apologize for that.
That's right. You just said that. I'm going to put that right here. Okay, great. Thank you so much.
Thank you. I appreciate it.
Yes, ma'am.
Okay, thank you so much for sharing, Brenda.
Thank you.
I have Dominique Malcolm. If you want to share briefly what's going on with your program, and then following that, Bryce with the City of Madison, if you would share.
All right, good morning, everyone. I'm Dominique Malcolm with Action Incorporated. You heard from my colleagues, Brenda Dove and Jim Doherty, but I wanted to let you guys know that we are finishing up the planning stage for our newest program called Number One Dads, which is a fatherhood initiative program. And we're looking to serve individual fathers in Morgan County as well. So if you guys know anyone who may be interested, or if you guys would like to partner with us on some resources for our fatherhood program, I will have my information down in the chat box. There will be incentives for the program for those who participate, and also it's free of charge. And we just ask that they have some type of justice involved. But if you would like more information, again, I'll have my contact information in the chat box. And we're so excited. Starting April 1, we can begin running this program. So I hope everyone have a good day.
Thanks, Dominique. And that sounds like an awesome program. So hopefully we can get some fathers involved with that. Bryce, you want to go ahead and share from some additional information from the city? And then following that, Allison Hawk.
Sure. Bryce Jack, City of Madison's Planning Department. Just two real quick items. Arbor Day is coming up. We'll be having a tree planting ceremony regarding that. And we got a couple of folks in our department working on getting some trails for the eastern part of town. So walking trails and such. And that's sort of that's a long-term project, and the tot lot's just about wrapped up on Whitehall Street. So anyways, that's where things stand, and wish everyone have a good day.
Thanks so much, Bryce. Allison Hawk, and then following Allison, Michelle Maddox.
Hi, everyone. I'm Allison from Kearney Valley Healthcare in Greensboro. We have not had a lot going on for updates in the last few months. I don't know how many of you are familiar with our office in Greensboro, but we had a daycare facility that shut down in 2019, but construction just started in that facility to move our pharmacy up there to get more room and upgrade it, as well as have our sick clinic that we started at the beginning of the pandemic become a permanent fixture for our company. So it'll see all sick patients and kind of keep them separated from patients who just need to come in for routine visits. So that is our biggest update for the last few months.
Okay. Thanks so much for sharing, Allison. Michelle Maddox, and then following Michelle, Renee Spires. Okay. Did Michelle log off? Is Renee still on the line?
Yes, I am. Can you hear me?
Yes, go ahead, Renee.
Okay, good morning, everybody. And I did want to note, I'm Renee Spires. I am the one-stop coordinator for the 12 county region area. And I'm also part of I'm the one-stop coordinator, but I am part of WorkSource Georgia. So what you did mention earlier, Veldy, is correct. Monies are still very limited with the WIOA programs. However, there are certain areas that they are able to support right now, and still, of course, continuing to look for folks that are interested in other education opportunities, dislocated workers, and so forth, if they're needing assistance. And as part of the One Stop, of course, WIOA is one of my partners, along with Action, who has already spoken with us this morning with several representatives. I've also I want to give out, and I will put it in the chat because I think I put my regular email address, but I do want to put that the one-stop email address. If anybody has questions, they're looking for information for folks to get them connected with different partnerships for continued education and or seeking employment. That is Northeast Georgia, all together one word, .onestop@gdol.ga.gov, but I'll put that in the chat box. But also wanted just to do a really quick update of how I've been spending some of my time, especially with all the pandemic going on and things having changed. I am spending a good bit of time assisting the Department of Labor, helping them with returning calls and helping with customers that are seeking information or trying to get issues resolved with their applications for UI benefits. And just to share a couple of things that information to let you know that the Department of Labor statewide has had up to 120,000 people apply for unemployment benefits in any 1 week. The numbers have definitely gotten much better over time. I think now at this point, they're more at 18,000 applications per week. And so, of course, staff are working really hard to process cases, help the customers get what they need, the services. And so with me trying to handle some of the phone calls, that's helping some of the staff actually be able to concentrate and process cases. But Department of Labor has paid out almost $17.6 billion since the pandemic started, with over 4 million claims processed since last March. So a big undertaking for sure. I know we're not finished helping those in Georgia that are needing assistance, and in our 12 county region as well. But they're working really hard for that. So if there's anything that I can share with any of you, any assistance that I can provide, please email me, and I'm going to put that in the chat box now. All right. Thank you.
Thanks so much for sharing, Renee. We appreciate it. Dr. Babs, if you have anything you want to share, and then following Dr. Babs, Travis Williams Ellis.
Okay, so Wayne, I think Wayne Myers is on here for first. Michelle Maddox was on for first. Is Wayne still on? Because he can give you a quick update for first. And I know nobody's on for Boys and Girls Club. So I just want to announce about Boys and Girls Club. We're getting a new director. Sarah Swoop is her name. She was with the Lemon Tree, and now she's going to be our new club director. And we are working on plans for a larger Boys and Girls Club at the middle school. We now have the gym, and we'll have some other area there. We'll be sharing it with some other organizations like Georgia Military College. But at any rate, we are in the process of having a wonderful new facility at the old middle school for our boys and girls, a teen club for our teens. And we're going to be able to expand once COVID is under control. So we're very excited about that. And if Wayne is on for first, I wish he would give you a quick update. If he's not, don't worry about it. We're doing well with first. We're partnering with the schools for the infancy to 5-year-old program. And we've got a great partnership going on. We love working with Morgan County schools. Thank you for asking.
Thanks, Dr. Val. She always gives great updates. And Dr. Myers, I think, is still on. He will go right after Travis though. So Travis, if you want to share anything you want to share extra that Krisha from Krisha's report.
Yeah, I just wanted to say hello. I'm Travis Williams Ellis, the PFC coordinator for the regions in which we serve, parent, family, community engagement coordinators for specialists for the regions that we serve. And I want to say Krisha did a great, Ms. Glover did a great job kind of breaking down the services and what we provide for the area. And if there's anyone out there that, we can contact or resource with, that we're looking forward to moving forward to 2021 to help out the region and the area.
Thanks so much, Travis, for sharing. Dr. Myers, you want to add anything to what Dr. Babs had to say about first readers and kind of what First is doing in the community?
Yeah, I'd be glad to. First of all, to remind people that First Readers mails books every month to children under the age of 5 in Morgan County. Our current situation is that we are very behind in enrollments. For some reason, people are not enrolling kids. We're not able to get out to some of the events that didn't happen, of course, where we usually enroll kids. So we're really asking people to help us enroll kids as much as you can. All they need to do is go to childrenfirst.org, and there's a link there for registering your kids to the program. Remember, it's totally free. The books come in the mail, so there's no need to where you have to go pick them up or anything. It's a great opportunity to have some more books in your home to share with your children during the pandemic when you've got them sequestered with you. So please take advantage of this and share that information with everybody you can. Thank you.
Thanks so much for sharing, Dr. Myers. We're down to our last couple of people that's going to present. Angela Browning, she started speaking a little bit earlier, so she's next, followed by Simisola Johnson, and then we will end with Shanice Cohen. So Angela, Simisola, and then Shanice in that order. Is Angela Browning still on the line? Okay, Simisola.
Good morning, everyone. How are you all doing?
Good morning.
And I hope you are staying safe. My name is Simisola Johnson, and I'm the Business Services Recruiter for Department of Labor, Region 5. just because of the COVID, we have not been able to travel to see any employers in need of employment. And because of the COVID, we are not also open to the public. But in this situation, my unit is able to roll over to the unemployment unit, still assisting employers filing partial claims for their employees that their hours are reduced, and also assisting the UI benefit, as Renee said earlier. So my unit is moved over to help them in processing claims, calling applicants back that couldn't get in touch with us because of the volume of phone calls. So we are able to call all these applicants back and to assist them with any questions they have about their unemployment. Right now, it's tough, it's overwhelming, it's stressful, but we are doing the best that we can in processing claims and answering all kinds of questions in regards to the unemployment questions. So if you have any questions, if you need any assistance, you can email me. I think I already have my email chats there. And I still have employers that are looking for employees, especially CNA. They don't have to have a certification. The employer will train, and mostly in maybe Athens and Albertine area. So if you need any, some of your high school students that have gone through the medical school or CNA, I have this employer and she's paying up to $15 an hour. So that's me. That's what I'm doing right now. You can't see me because I'm in my pajamas. We are working at home. So that's why I cover myself up. Thank you so much, Valdi, for all that you do. Thank you.
Thank you so much, Simi, for that update. It's good to hear you this morning and presenting. Shanice, we're going to end with you. I think that's everyone. If I missed anyone, let me know. But Shanice, if you're still on the line, if you want to give us a quick update.
Hi, Ms. Valdi. Yes. Good morning, everyone. Just doubling back on what Brenda, she gave out information. We are still helping with housing assistance and electricity assistance as well. If there's an unexpected expense or a loss of income, they can give me a call. I'm also going to send out our updated flyers. I could send it out in the collaboratory meeting email that we always get, or Ms. Valdi, if you don't mind, I can send you the flyers and you can send them out as well. Either way, it doesn't matter, but I will be getting out those updated flyers from Action Incorporated.
Okay, thank you. And yes, you can send them over to me and I'll try to get them out to everyone as well.
Okay, thank you.
Okay. All right, well, that brings us down to the end of this meeting. I know it was a lot of information, a lot of great updates and highlights from several of our partners and all of you all. And we appreciate all the work that you continue to do here in our community. Thank you so much for being a part of the meeting today. I'm not going to hold you. It's 10:30. We try to go no longer than 10:30. So again, thanks for all the work that you do. If you have flyers that you want shared from this meeting, email them over to me. And when I send out the link, I'll just try to attach all those flyers, partner flyers, with the recording a little bit later this week. So I appreciate all that you do. Remember to stay safe, continue to impact our families here and our children here in this community. And I look forward to our continued work together. Have a wonderful, wonderful day.
Thank you.
Thank you. Thank you, Valdi.
Thank you, Valdi.
Thank you.
Thank you, everyone. Have a good day.
Thank you.